Dr. Ajoy Tewari, and I am a consultant diabetologist and director of Jai Clinic and Diabetes Care Center, Lucknow, and I am also currently the secretary of UPRSTI. So today I chaired a session, a very interesting session as regards to novel therapies for management of hyperkalemia. So you must understand that with the use of drugs like RAS inhibitors and MRSAs and the profile of the patients with chronic kidney disease, heart failure with an electrolyte imbalance, we are having more and more patients with chronic hyperkalemia. So we need to understand how to manage hyperkalemia, and that too a chronic hyperkalemia. So we all know that a level of more than 5.5 is labeled as hyperkalemia. So this was discussed, and then some novel agents were discussed. So the problem with these agents was like patiromer was discussed, then sodium zirconium cyclodextrate were discussed, SCJ was discussed. But the problem with these agents is that they are not readily available in India. So again, when the discussion went ahead, so we said that what could be done in our settings, like in Indian settings, how we can prevent the chronic hyperkalemia. So the DASH diet was the dietary restrictions as regards to hyperkalemia. So they were highlighted, and then the key message was that all fruits contain high content of potassium except for papaya, pineapple. So these things were emphasized. So the clinical essence of the entire talk was that we should be receptive to this idea that the current treatments that we are using, like the RAS inhibitors, MRSAs, and the new ARNIs, we have to be very careful as regards to hyperkalemia. And if we have hyperkalemia, we have to think and we have to manage these things, and we have to understand. And with these therapies, like the newer agents coming more and more in India, we may be able to use these things more and more in the future. Thank you very much.